on to the case scenarios, and this is your case number 3, where we will try to approach a question in a clinical way, how to approach the question, how to go about the things, and how we can make the diagnosis by excluding the wrong options also. So let's get started. Here we have a 4-year-old boy who is brought to the physician for a routine health maintenance visit. Now, this is an important point that this 4-year boy is not having any acute problems. He has just come up for the routine examination. He will be starting the preschool soon, and his parents wants to make sure that he is in optimal health. Now, this is a very good point. I think we always lay the emphasis on the screening and the routine checkups, and the day the people start up with this, they will be landing up in less and less problems. So, you know, these also like one of their kind anxious parents, the school, their child's school, preschool has to start soon. So, they are actually anxious and they want to make sure that everything is okay with their child, and that is why they have brought him for the maintenance examination visit. Now, the patient is toilet trained for the day and night. So, this tells you that how much is the developmental information, developmental milestones achieved. So, 4-year boy has achieved the developmental milestone of the toilet training. He is eating a well balanced diet. He takes no medication, so he is at an average a normal boy who is having a normal toilet training. He is taking a good food, he is not taking any medications. He has a history of acute otitis media that occurred twice during the infancy. He lives with his parents in a suburban house built in 1981. The patient's father has a history of high blood pressure, quit smoking cigarettes before the boy was born. So, this boy is having a active, good, healthy environment. The father is having hypertension, but he has quitted the smoking. So, he is really worried about his child. He has actually quitted the smoking even before the child was born. Then he is living in the suburban house. He is on the balanced diet. He is taking no medications. He is having good milestones achieved. And literally I can say that there is nothing uneventful, just leaving the 2 episodes of acute otitis media. Now the examination shows a active cooperative boy, speaks in full sentences clearly. He can balance and hop on one foot. Which of the following is the most appropriate next step in this patient's primary care? So, you know, public health is getting more and more important nowadays, and even academically it is more and more important considering your next pattern of examination, because now on 10% of all the questions from all the subjects will be related to the public health. So, ideally, you know, this should be the scenario where the people should be more concerned about their primary and the primordial health care, rather than waiting for something to happen and going for the early diagnosis and the cure of that particular disease. So, let's see the options. First is the meningococcal vaccination, then monoocular visual acuity test, third, rotavirus vaccination, or the serum lead levels. Okay, now don't jump up to the option number 2 just by thinking that ma'am is discussing and that is the only ophthalmology option available there, because I won't be discussing this case in exam. So, if in the exam you are getting the same question, your horizon is diverged, and you have to open all of your options. You have to keep your fingers crossed. It can be a question of public health, it can be a question from pediatrics, it can be a question from ophthalmology also. So you have to keep your mind open and see what are the possibilities that you are going to do in this child. Is there any indication of doing the meningococcal vaccination this time? Like usually what is the normal time when I should give this meningococcal vaccination? It is around 1 year, that is the first dose, and around the 16 years that you give the second dose. This is your first dose and this is your second dose, that is your booster dose you are going to give. Now because this child is a good one and he is being taken good care of, I think that he must be given the first dose of meningococcal vaccination around 1 year of age, though nothing has been mentioned, but it is not the age when you can give the second dose or the booster. Second important thing is that you are not having as such any other indication that will justify giving the meningococcal vaccination this time of the routine, because it is not a part of your universal immunization program also, because in those vaccines you are giving the vaccine whenever the child is coming to you. Okay, so even if it is not given at the right time, you can give the vaccine if it is a part of universal immunization program, and this meningococcal vaccine is not the part of it. So this 4-year child who is healthy, he is having healthy food, he is trying to speak full sentences, he can hop, he is doing everything normally. So there is no indication of giving this meningococcal vaccination, right? Now the option number B, the monocular visual acuity test. So I'll come back to this. First see the option number C, the rotavirus vaccination. Now this child is again not having any active disease, he has just come up for the maintenance. So there is no as such indication for giving this rotavirus, and I think it must have been given also, because usually we give it somewhere between 2 to 8 months of age. So most probably the child would have been given this rotavirus vaccination. If at all it was not given, there is no clear-cut indication this time at 4 years of age that he should be given this rotavirus vaccination. So this is also gone. Now you are there with the option number D also, the serum lead levels. What happens that lead poisoning or the lead toxicity is quite common. It is quite common in the children when we are using the lead paints, or we are using the toys which contains the lead and the children are playing with them, keeping them in mouth. So sometimes what happens, the lead toxicity occurs. Now this lead toxicity, if the child is having this lead toxicity, you are going to expect both the growth delay, there will be delay in the physical growth, as well as there will be delay in the development also. Growth delay as well as the developmental delay, both are expected. If the child is having lead toxicity, there will be disorganization in the child will not be able to remain normal, he will be disorganized, he will be hyperactive kind of a child, he will be disorganized child. So you are not expecting the normal physical as well as mental growth in this child, which is not the case here. This child is absolutely normal physically, he is having the developmental milestones achieved, he is also normal mentally, he is able to speak the sentences also, he is balancing, he is hopping on one foot. Okay, so everything seems to be normal, there is no signs of the lead toxicity due to which you are supposed to do the serum lead levels. So by default also the answer to your question will be the monocular visual acuity test. Now justifying this option. See, once our child is very quickly to begin his school, whether preschool or school, what do we expect? See, what happens if I talk about the eye at birth? If I talk about the growth and development of the eye at birth is very, very small, and that is only 16.5 mm at the time of the birth. Now this 16.5 mm is 70% of the adult size. It is just 70% of the adult size, and therefore the eye is actually hypermetropic at the time of birth. Therefore eye is hypermetropic at the time of birth. Now slowly and gradually till 5 to 7 years it actually becomes emetropic, right. So before the age of at least 5 years, we are not expecting this child to become emetropic. And when I want my ward to be sitting in the class, what is the normal expectation? I want this ward to see at a distance also. He should be able to watch the faculty class teacher. He should be able to see the blackboard. He should be able to see his notebook. He should be able to see the neighbor's notebook also. You know, that is the most important thing. Children are excited going to the classes because they get friends there. Then they should be able to recognize the certain things. They should be able to differentiate between the different colors. This is apple, this is mango, this is banana, this is the flower. So flower has a red color and a leaf has a green color. So that means their visual acuity is very, very important. In this respect, their visual acuity is very, very important. And you know that at 4 years of age, most probably this child will not be emetropic, and minimum age group in which the emetropia is attended is your 5 to 7 years. So on that basis, visual acuity recording becomes a very, very important thing, because you know all the reflexes are also attained by the age of 5 to 7 years. Fixation reflex we get between 2 to 4 months. Then we have the macular differentiation that we get between 4 to 6 months, and then finally we get the stereopsis. Finally, we get the stereopsis. Now, this stereopsis starts between 6 to 8 months and then it completes by 5 to 7 years. So 5 to 7 years, you know, becomes an important time when, you know, final visual acuity, both in terms of the vision, both in terms of the reflexes, is obtained by this baby. So therefore, monoocular visual acuity test becomes an important prerequisite before getting the admission in the school. Now, how do you prefer taking this visual acuity? We know that the most important chart that we use for the visual acuity is the Snellen's chart. But you know, Snellen's chart is something where the patient has to stand at a distance of 6 meters, and it actually requires the literacy, because the child should be able to read the alphabets. And till now he is just on home, and most probably 4 years child will not be able to read the alphabets. So what else I can do for it? So for that I can actually use this E chart for taking the visual acuity, or I can use this C chart. This is called as the Landols C chart. This is called as the Landols C chart. So if you feel that even these charts are getting difficult for the child and he is not able to tell you the E chart or the C chart, he cannot follow the instructions and tell you that in which direction the mouth of E is opening, then we can also take the help of these kind of a chart. These are called as the simple picture charts. These are called as the simple picture chart, and this is basically used for the preschool children between 2 to 5 years of the age. So I think this is the most appropriate way of taking the visual acuity in this child, where you are using the simple pictures which are used in day-to-day life, that the child can recognize without any difficulty, but the ratio and the proportion of the pictures in these chart will be exactly equal to that used in the Snellen's chart. So the topmost picture will be equal to the topmost letter, then the next and next, and certainly as we go down and down, the size of the pictures becomes smaller and smaller. So your ultimate interpretation of the visual acuity will remain same. In the topmost picture it will be 6 by 60, then it becomes 6 by 36, 6 by 24, then we have 6 by 18, 6 by 12, 6 by 9, 6 by 6, and ultimately we have 6 by 5. So this is the most appropriate step that one should do. We should take the monoocular visual acuity test, and if at all they are asking how should you take it, the answer will be simple picture chart. So hope you have understood more than the question itself. I think it is the approach that you have to learn how to approach such kind of a question. And whenever you have got clinical case scenarios, it's not always mandatory that you are reaching a particular diagnosis directly, because whenever you are getting a patient, you have to keep certain options in your mind. You have to start excluding the other options, and it is the best, the single best answer or the most appropriate answer that you have to go with. So if you have learned that art of diagnosing the things by excluding the wrong options and finding out what is the most preferred, most important thing that you can do here, that will help you like anything during the examinations also. Because if you do not have that skill, obviously you will spend much of your time reading the question itself, and then in the last you will be falling short of the time. If you remember, the same happened in NEET 2020 also, because we were not expecting so many clinical scenarios, we were not having practice of dealing with these questions, and that took a whole lot of time. And at last the students were running short of time, and they were not able to even read those questions. So it's a good time when you can practice the clinical scenarios, and you will develop that acumen how to go about it and give the right answer. Thank you and happy ophthalmology.